This episode is sponsored by our friends over at Hippo Education. Quick question. When was the last time you felt you were fully up to speed on the non-stop updates in pediatrics? Let me guess. Never. That's where Hippo Education's Pediatrics Reviews and Perspectives podcast comes in. Your monthly pediatric cheat code. Fresh, up-to-date insights from pediatric clinicians who live and breathe the same challenges you do. No fluff, no boring lectures, just practical knowledge you can apply on your next shift. The best part, you can listen and earn CME whenever it works for you on your commute between patients or during that rare quiet moment. So, if you're ready to make staying informed easier, check the link in the description or visit hippoeducation.com to try Hippo Education today. Hey, George, good afternoon. It's an interesting day today. It's a Sunday.
Yeah, it's a Sunday. We never do podcasts on Sunday, but we have a fabulous guest, Dr. Jason Terk. We're transmitting from 3 different time zones, Virginia, New York, and Vail. I'm on vacation, but this topic is so important that we have to find the time to do this. So we managed to do it.
Don't oversell it. Under promise, over deliver. All right.
Yeah, this is a good topic. All right. So the topic
we're not really Virginia, New York, and Vail. We're Virginia, Texas, and Vail.
Oh.
The world doesn't go outside of New York, George.
Oh, geez. Did I say New York? Texas.
Yeah, you did.
All right. All right. Let me tell you the topic. The topic is the return of measles, how hesitancy and disinformation are endangering our children. Take it away.
So before we welcome our guest, it's been a long week. George is out there in Vail skiing, having fun. I just came back from speaker training with Stride in Detroit, and the weekend before I was at Vegas speaking to DPC pediatricians on prevention of type 1 diabetes. Forgive me if I'm a little bit slow today. Dr. Terk attended the University of Texas Medical Branch in Galveston and received his medical degree in 1993. He completed his residency in pediatrics at the Mayo Clinic in Rochester, Minnesota in 1996. He's a distinguished consultant with the Cook Children's Physicians Network and practices in Keller. With his 5 pediatrician colleagues, Dr. Terk is a passionate advocate for vaccines and is past chair of the Texas Medical Association Council on Legislation. He's past president of the Texas Pediatric Society and serves on the Executive Legislative Committee and Committee on Infectious Disease and Immunization. He also serves in the American Academy of Pediatrics Committee on Federal Government Affairs and is an immediate past president of the Texas Public Health Coalition. Dr. Terk is married to Rose, his talented wife for 29 years, who has made much of his professional passion possible. They are parents to 2 grown sons. Dr. Terk, welcome to the show. Thank you for joining us on a Sunday afternoon.
I'm very pleased to be with you both.
Why did you become a pediatrician?
It goes back to childhood. My father was a veterinarian, and I would go to the office with him to attend to sick animals. And so I had an early exposure to taking care of animals. It kindled in me a sense that would be something I'd like to do. I went to a Jesuit high school where my focus for service transitioned from being a physician for pets to being a physician for humans. We had to complete 100 hours of community service as a graduation requirement. I did mine at a hospital, and it really opened my eyes and made me feel at a pull in that direction. And then finally, in medical school, I knew that I needed to do something that would sustain my idealism. I thought obstetrics and gynecology would certainly be the thing to do. And third year of medical school cured me of that. And the next rotation after OBGYN was pediatrics. So that's where I really understood what I was called to do, taking care of kids. It's been a joy of my life, my entire career.
So I'm curious, was that hospital Parkland Memorial?
Yes.
So did you come across George McCracken or Eichenwald or Nelson in the pediatric department and that huge, people don't understand. This is like a whole city to itself.
It is.
But at our age as young men, these were gods of medicine.
Keep in mind, this was in high school, and I was doing a volunteer work in the outpatient clinic pharmacy. I was in a grunt position. I was not in the orbits of these giants at that time.
Okay. But people, this place is a whole city to itself. The PICU is bigger than most pediatric wards in the country. And they had, back in the 80s, they already had a PICU for cardiac patients and a general PICU that were separate. This is a Oh my, this is beyond a world-renowned institution.
Correct.
Uh, to just be even just to volunteer there is an honor.
An honor that I didn't understand at the time, but certainly had its impact upon me.
Wow. Wow. What a journey. Let's discuss measles, a vaccine preventable disease. And in the show notes, we'll refer to two previous episodes, episode 078 with Dr. Jackson, the Dean of the Medical School in Kansas City, and episode 101 with Dr. Offut, if you want to dig deeper into some of our conversations about the disease. Measles is a very old disease, right?
Absolutely. We noted for as long as we had pediatricians in pediatric medicine for the most part.
Yeah. So I believe the first time they identified the virus was in 1898. And in 1954, Dr. Anderson Peebles reported the virus that they could reproduce. What are the manifestations of measles for those of our colleagues who have not seen it and the parents that might listen to this episode who have never, they've been so lucky as to never see measles in their child?
To be sure, I never thought I would ever have a chance of seeing measles in my career, and I regret that. I think that might not be the case now. It begins as a fairly familiar presentation of a runny nose, an exudative conjunctivitis, cough, those are the early symptoms, which are fairly indistinguishable from any other viral infections that a pediatrician might encounter in a busy pediatric practice. The fever begins in the first few days, up to 5 days after the first symptoms may appear. And it's fairly high fever. And these children typically look quite sick. Uh, Unfortunately, that their illness may appear upwards of 10 to 21 days after they've been exposed. The incubation period is fairly long. And then you have symptoms of approximately 4 days duration, usually before you see the classic measles rash, which is described as a papular rash that comes down from behind the ears initially, and then the neck and the face, and call it a sort of a waterfall rash, the ears all the way down. And the rash is present, as I said, about 4 days after the initial symptoms. It may last about 4 days. There are some pathognomonic manifestations of complex spots. If you see them, they're not always there, but if you see them, that is specific and unique to measles. And then the illness may last for up to weeks, 10 days, the acute illness, but complications may occur, which are concerning, and hospitalization is not uncommon.
So, what are the complications that we know of with measles? Because they're quite severe in many of them.
Probably the most common complication that you may see in children with measles and adults with measles is pneumonia. And that is one of the reasons for hospitalization, most common reasons for hospitalization. But unfortunately, more serious complications may arise, such as measles encephalitis. As we all probably know, there is no specific treatment for measles. There are supportive treatments, including administration of vitamin A, which may mitigate some of the severity of the illness. People die from measles. We've already seen that a couple of times in this particular outbreak. There is a very late complication, which is 100% fatal, called subacute sclerosing panencephalitis, which may appear years after your acute measles illness. It's quite rare, but it is 100% fatal and a devastating complication.
So this is
Measles is one of those diseases that, since we've been given the vaccine, it's gone, and physicians may not even recognize it other than the textbook pictures. But there was an epidemic in 1993. I lived it, and I got the measles. And I can attest that the patient had high fevers, 104, 105, the cough, cold, congestion, the eyes, and they described the rash. It's like almost taking paint and dropping it on the head, and it drips on down the body. The complex spots, truthfully, I don't think anybody ever saw them. They could, maybe I've seen it once, one kid where they had like a rice molecule or something in the back by the molars, but the complications of pneumonia, otitis, mastoiditis, dehydration, encephalitis, very real problem. I witnessed them.
In George, the conjunctivitis, which is an early symptom, I am informed, is not just a little bit of goopy eyes. This is like
It's lip blowing red.
a virus kind of
Yeah.
Conjunctivitis.
Yeah, it's lip blowing red, and it's horrible.
What
Yeah.
and it doesn't have pus, so it's
No.
a vascular problem. And there a lot of patients also have severe photophobia, and
Yeah.
the Koplik spots are on the buccal side, not by the
Mhm.
molar, and it's pathognomonic, and it's seen quite
Mhm.
frequently, but they are seen before the rash starts, so by the time the patient comes in with a rash, we will often miss it. Uh,
Yeah.
the terrible thing about subacute sclerosing panencephalitis is that it is a regressive, progressive disease. So you have a normal child going to school, and they will start not performing as well academically in school, and they will progress to having intractable seizures and then followed by death. And there's absolutely nothing you can do as this progresses, and you watch a child wither away and die. I cannot imagine as a physician, let alone as a parent, to watch this in your child.
Yeah.
Just horrendous.
And one thing that's actually not that uncommon among people who have had measles is that measles has an unfortunate predilection for wiping your immune memory for a lot of other things that you've been vaccinated for or that you've had natural immunity to. And so you'll find yourself immunologically vulnerable to things that you previously were not.
Yeah.
Absolutely. How contagious is measles?
It is simply the most contagious thing that we would ever see, that we know of. Some of the listeners may have heard of a calculation called R naught, and it is important to understand what that means and what it doesn't mean. It refers to the contagiousness of a particular infectious disease in a completely susceptible population, which is not what we're dealing with. Different agents, infectious agents, it's a useful measure to understand how contagious measles is. And so if you consider more familiar things that we know about influenza, COVID-19, which have R naught values, 1.5 to 3, depending upon what strain you're dealing with, some a little bit more. Chickenpox has an R naught value about 10 to 12, and then measles is about 12 to 18. So what that refers to is in a completely susceptible population, one ill individual with measles would be expected to cause 12 to 18 additional cases.
And not there's some viral factors why that happens too, but that long incubation period, so the patient is completely, from what you can tell, normal up to 3 weeks, and they may be spewing the virus out their nose and there's no symptoms.
So
So if
we
you're
have
a vulnerable population exposed to measles, 90% will get infected. And if that wasn't bad enough, if you walk into a room after 2 hours after somebody has been in the room with measles, you may still be infected. It's an incredibly dangerous disease as far as its ability to infect vulnerable populations.
and her is actually a bit of a, one of the, what that's demonstrated very well in the population of people that are now suffering with this out in West Texas. They may live out in rural areas of West Texas, but they tend to drive long distances for shopping and visiting family. And there was one individual who later developed measles who had been to San Antonio and San Angelo and had been in high density population areas uh, well before this person developing measles. We don't yet know if there are going to be additional cases arising from that history because of the long incubation period. And so we'll just have to see. It also brings to bear the significant operational challenges in managing this in an area where you're having a potential measles outbreak from an office point of view, from a hospital point of view, and how you handle these situations so you don't end up creating additional illness.
Right. And before vaccination, how many children get measles every year and how many die in the United States?
So it before we had routine measles vaccination, it was a very common childhood illness. 500,000 people having measles every year. Approximately 400 people that died from measles every year in the United States. We had routine vaccination coming to the population in the 1960s. There was initially a killed virus vaccine, which was less effective. And since 1967, we've had a live virus, which is highly effective.
Yeah, and that was the work of Dr. Hillerman at Merck, who Paul Offit describes beautifully in his book Vaccinated, and all the work he did. People don't understand how much work it goes into creating a safe and effective vaccine. This guy at one point had Merck growing chickens so that the eggs were absolutely pristine. There was absolutely no risk to the children. And Merck became the largest breeder of chickens and eggs in the world just to produce the vaccine. These scientists and these pharmaceutical houses leave no stone unturned to try to make sure that these vaccines are safe and effective. And they will go to no end to make the vaccine as safe as possible. Of course, every vaccine has side effects. Anything you do in life, unfortunately, there's people that go to the bathroom, they have a heart attack and they die. It's just other people are in the best of shapes. They go into the gym and they start lifting weights and they have a massive heart attack and they die. So you can never eliminate risk. But this is an incredibly well known, studied, and safe vaccine that no one should have any concerns about getting or having their child receive. It's really truly a miracle of the age that we live in.
And I think people who worked on these vaccines are heroes. I think that the amount of good that has been done in protecting people from serious illness and death is incalculable. And we really do owe them our appreciation for the work that was done so many years ago, and which we're continuing to experience the benefits of today. And unfortunately, we do know that vaccines are potentially a victim of their own success.
Yeah. I think parents sometimes are hesitant about vaccines because children ultimately will get better despite what we do to them most of the time, right?
That's
So you're going to take
that's not
I said most
that's
of
not
the
true with the
time.
disease. Children die from this disease, and the
They
world needs to
do.
know that you cannot take a risk. That
Yes,
is
you're
not
correct.
true, George.
You're correct. But in general, children sometimes get better before we just because they're very young and they have very strong immune systems, then they get all the diseases. And because of that, parents become hesitant. Says, why should I give my kid the vaccine? I think vaccinations are very complicated, herd immunity and all that stuff. And parents just don't understand that. We're not really giving the vaccine for your child not to get the vaccine, but to get the illnesses. So you can get immunity so the illness disappears around town. And then they don't die from disease. Yes, there's going to be deaths from these illnesses. Right now, we're having, I don't know how it is in Texas, but the flu vaccine, the uptick on flu vaccine is minimal to none. People just don't want it. It's
Okay,
amazing.
George, I think you're right in what you're saying. Paul Offit says this.
Yeah.
There is no memory because the grandmothers and the mothers have not seen children
Yeah.
die from vaccine preventable disease.
Yeah.
That does not mean that this is not a serious disease that kills children.
I'm very serious.
And we cannot compare the measles vaccine with the influenza vaccine because the influenza vaccine is not effective. In a bad year, it only prevents 25% of people from entering the hospital with influenza. In a good year, 50%. Measles prevents 95 to 98% of all cases of measles in your child. So they are not the same vaccine. And I would prefer that people get their influenza vaccine, but the risk of dying from measles or being in the hospital for children, for your child that you're not vaccinating, let alone what we call herd immunity, is not the same as as what we see with influenza. So they're two very different things that we're dealing with.
Or would we be so lucky that our parents were making these decisions based on information and statistics and relative risk assessment? But that isn't how parents and the general public are thinking about vaccines and public health and expertise nowadays. I think that created part of the complex suit that we're dealing with, which has led to what we're seeing right now.
You're absolutely right. What was one of the biggest? So, what's going on right now in Texas with this? I want to call it an epidemic, but please no, it's not an epidemic. It's an outbreak of hundreds of cases.
just from a factual point of view, what's happening right now is we are now up to approximately 198 cases of measles that have been primarily seen in rural West Texas, not far from Odessa, Middle Odessa, and Lubbock. These are sparsely populated counties in West Texas. The current outbreak centers around a Mennonite community out there, and they, like many other communities that are similar to them, are fairly insular, and they do their own schooling, and they infrequently encounter other people outside of their communities. But they also have a culture in which decision on what to do is fairly hierarchical, comes from the father of the family, and everybody falls in line with that. It's part of what they do. And that's not a value judgment. It's just a statement of how they are. And they tend to be, like many people in Texas, highly individualistic in their point of view, and they distrust authority figures and expertise, and they don't want to be told what to do. That's common throughout our culture here in Texas, but most especially out in West Texas. And so birds of a feather flock together. And if you have a susceptible population that's ready made, like apparently what we have had in the Mennonite community out in West Texas, and you have measles come into that community, it's a perfect breeding ground for an outbreak, which is what we're seeing right now. But just as I mentioned before, they have to do shopping, and they drive long distances to go to store, and to buy things, and to go do things. And even the landscape out in West Texas makes you think you're all by yourself. You're never an island, and the decisions that are made by us as individuals will never just stay with us. It's potential risk for everybody else, which is the nature of public health and why we preach getting vaccinated. That's not a message, unfortunately, that resonates very well nowadays. It's become even more challenging since the COVID-19 pandemic. And frankly, we're losing the narrative and the arguments for public health.
Yes. So, my understanding, there's almost or maybe over 200 cases in Texas and some in New Mexico and in Texas. Of the children that are getting measles, close to 30% are being hospitalized.
Yes. So there were, as I mentioned, the 198 as the last report, people who are sickened with measles out in West Texas. The vast majority of those are children, and there have been many children hospitalized in children's hospitals in Lubbock, which is where the one individual died. So a school-aged child who was unvaccinated. I've actually spoken with some of my colleagues out there who have been taking care of these children, and yeah, so it is not unexpectedly the children that are hit the hardest with this condition. There have been some tangential spread to neighboring counties in New Mexico. I think there are about 10 cases in New Mexico, with one death of a non-pediatric patient. And then there are 4 other cases of measles that are not thought to be related to the West Texas outbreak in urban and suburban counties in Texas as well, that appear to be due to international travel.
Well,
Yeah.
and that child that died, unfortunately, was not vaccinated. But most importantly, too, because people will be so glebe and it's so aggravating, even pediatricians. He must have had some secondary illness or some underlying disease. No, he's a completely normal child. No asthma, no underlying conditions. He
Mm.
didn't die because he was at the end of life with leukemia and he got measles. No, he died as a healthy young person, got measles, because not all children get better. Everything isn't easy in pediatrics. We
Right.
minimize it, and we do a disservice to the community when we minimize it. We do great work, and children do die from these diseases, and we should be scared of them, and we should not minimize it. We should let people know these are scary and awful diseases. You don't want to be on the other side of the table when someone walks in with a white coat, sits down here, and says, "Your kid is gone. It's gone from measles."
And the moral injury associated with this is not inconsequential. The residency training program director, the PEDS program out in West Texas, Lubbock, has had to stand up a process to help the rest take care of themselves as they've been trying to manage the grief associated with taking care of kids who have been extremely sick and the one who died. And all of this was entirely preventable. We all go
Yeah.
to pediatrics because we have an internal pull that we want to take care of kids. We see them as our most precious resource, and we want to do everything we can protect them from things that are preventable. And when decisions are made and acts of omission occur that lead to preventable morbidity and mortality, it hits us as pediatricians in a uniquely difficult way.
Well,
I
I can attest as a physician, as an intern, I contracted measles from those kids that we worked with during the epidemic in New Jersey. Let me tell you, it was not an easy disease. Even at 27, 28, however old I was, I got hospitalized for 2 weeks. Respiratory distress, dehydration, altered mental status. And there was really nothing that they can do. Just IV hydration and
And
yeah,
George probably were one of the people that had only had one measles vaccine, and that's when it was decided that you needed to have two.
right.
exactly because it was back in the paper days. So I wasn't born before 57 when you only needed one. And somehow I made it through kindergarten and school and medical school and so forth and employee health for internship. I had no titers. And then we worked in the emergency room, no titers, kids with measles all over the place. Lo and behold, Dr. Rugby got the measles. They got really sick. I remember getting all this thick mucus in my airways, just like scraping it out with my hand. I
Yeah.
couldn't breathe. It was horrible.
And
You
George,
also,
titers, I think it's one thing to just mention about titers, that the question has come up quite a lot recently in my area, uh, not just adults, but and our patients, but my colleagues. Should I get my titers checked? That there really isn't a reason to do that because
No.
majority of our immunity is cell mediated at this point, and titers are not going to tell you if you're protected or not.
okay,
Well,
so I'm gonna have you that because we're both on speaker bureaus for Sanofi, right? You on the Beyfortus side, I on the type 1 diabetes. And we do that work because, like you said, as pediatricians, we want to avoid bad outcomes. Right? So on the before side, you don't want a kid with bronchiolitis in the PICU. On the type 1, I don't what's even the drug's name? Tzield. I don't even care what the drug's name is. But Tzield is not the thing what I want is kids to be diagnosed early with autoantibodies so that we can prevent the children ending up in DKA at presentation in the PICU. So we do that a lot. So what's the difference between what you're talking about titers? What is the difference between autoantibodies or antibodies and T cell immunity, which is what this vaccine does, and many vaccines do?
I am a general pediatrician, and I'm not going to pretend to be a specialist in immunology, but I'll tell you my understanding as a general pediatrician. There are some diseases that we get protection from, primarily from circulating antibodies, which are produced by B cells, and you can, as a correlate of immunity, check to see what your titers, as in the levels of those antibodies, are for a particular disease, and say, oh, this person is protected. This is not the same for measles. The live virus vaccine that we have does produce some B cell response, but the majority of durable, long anamnestic immunity for measles vaccination is derived from T cells. It's cell mediated immunity, and you can't just draw some blood and check that as easy and demonstrate that point. I can assure the listeners, who some of whom may not be physicians, that if you have been properly vaccinated with 2 doses of measles vaccination, you have 98, 99% protection. You are as well protected as you can possibly be. That being said, it's also important to understand that if you have immunity levels that drop below a certain threshold, such that there is the increased amount of circulating disease, then every time you're exposed to the condition, it's a challenge to your immune system. And so our vaccines work two ways: by giving us personal immunity, but also vaccinating the community. So there's a decreased amount of circulating disease, such that we're having less challenges. Every time we have a challenge to our immune system, it's a challenge to our otherwise good immunity. There's still a chance that that immunity could fail.
That's right. So that's the best kind of immunity is immunity that the T cell immunity, because that's the one that prevents you from dying. And that's there till you die. It's just with you. The antibodies have to wane, otherwise it would be very hard for your immune system to allow you to live. You get exposed to something, you fight off the disease, and then the antibodies disappear from your bloodstream because they're not necessary anymore. And then there's an army of cells that remembers how to fight off that invading army into your body that keeps you safe for the rest of your life. That's how it works in layman terms as far as Dr. Office explained it. That's all I know because immunology is very difficult.
But
This episode is sponsored by our friends over at Freed AI Medical Scribes. Let's hear what they have to say. What if you could take the computer out of the physician-patient relationship? With Freed, you can. Freed is the AI medical scribe that listens, transcribes, and crafts perfect silk notes for you seamlessly. This isn't just another productivity tool. Freed is a life-altering solution for physicians, helping you regain the joy of practicing medicine. Freed frees you from the burden of documentation, so you can focus on what really matters, your patients. With Freed, the computer is no longer a barrier. It's a quiet assistant that works in the background, capturing every word of your patient interactions, accurately and quickly. The result: you're fully present in each visit, building stronger connections and offering more attentive care. And when the day is done, your notes are too, leaving you with more time to focus on yourself, your family, and your life outside of medicine. Freed is the solution thousands of physicians swear by to reclaim their passion for medicine.
but it is very hard. What you just described is a very difficult concept to grasp as a parent. They see it as, I take a poke, I prevent a disease in my kid.
You do with
Look,
that with measles. You do with
yeah.
measles.
Yes, you're correct on that.
You do with measles. What the parents see today, which is part of the problem, is my kid had the flu vaccine and then he developed the flu. And then he developed the flu from the vaccine. He was sick right after the vaccine. And then 3 months later, he had influenza, and I had to pay my $100
Yeah.
payment, Dr. Rogel, plus the flu test, plus I gave him Tamiflu, and then he threw up. He was sick twice. And what they don't understand, because it's very sophisticated, is when you get the COVID vaccine, when you get the flu vaccine, there is a cytokine release that causes you
Mhm.
to have fevers and aches and feel like not very good because your immune system is doing what it's supposed to do. It's responding to an invasion and it's learning how to fight off the infection. That is not the disease. And with the MMR, 95 to 98% prevention of the disease, 95% after the first dose, 98% after the second dose. So this is an incredibly effective vaccine in protecting your kid. You just don't know it because you've never seen anybody with measles. And how has this affected your practice and your families?
Certainly, there's been a renewed interest in people checking to see, make sure that their kids are vaccinated. I have your practice is going to be what you decide it to be, and I long ago decided that I was going to have a practice that we vaccinated according to the recommended schedule. We certainly have families who are vaccine hesitant, and if they're questions, my job is to talk to them about what their concerns and questions are, and then ultimately, hopefully, arrive at a decision to vaccinate. But there are some individuals who have made a decision they're not going to vaccinate, and those are not a part of my practice. That's not the same as many other practices out there. But with respect to my practice, I've had plenty of over 12-month-old patient parents call me to make sure that their kids vaccinated. I've had plenty who've had one vaccine, would like to get the second MMR early. Fine, happy to accommodate that. And it is certainly reasonable to do, especially if you have any travel plans to rural West Texas. It's certainly reasonable to do, of course, prior to 12 months of age, between 6 and 12 months of age, for any child who's going to be doing international travel. And for those individuals who wish to get it done early. We can make it very clear, of course, that an early MMR vaccine prior to 12 months of age will not count toward their two dose complement that they need on or after 12 months of age. And the families do understand that. But the
Do
children,
you do you any problems with vaccine with payment if someone gets a 6-month vaccine and then they get a 12-month vaccine?
so far, they,
I think
so far, that has not been a problem for us. It's usually come up with respect to anticipated international travel. We've had a couple of times we needed to appeal those things, but the MMR vaccination is not an expensive vaccine. And so generally speaking, if it comes up as a concern and the insurance is not paying for it, it's not been a problem for a cost.
Okay. So I didn't know what happened. If you got 3 doses, will the insurance plan pay for it?
I've seen problems with, like you said, with international travel. But right now, with this little outbreak of measles, I'm sure nobody will challenge it.
You would think so. Put a logic filter on insurance companies, and I'm sure it's going to come up.
Yeah.
Both
It's some
vitamin.
computer, it says this kid's gotten 3, this is the 3rd dose, we only pay for 2. That's
Yeah.
it, we're denying it.
Yeah. I think the edits and the filters for the insurance companies are, why did this kid get an MMR vaccine before 12 months of age? It's gonna Once they hit 12 months of age, they'll count those other two. Question is, will they count the first one?
Okay. Okay, so that's important to explain to parents if they're gonna fly to Texas. And is there any other way to prevent measles and develop herd immunity than vaccination?
Oh,
There's simply n
no,
okay?
no. Unlike people who would like to tell you, you can't take a whole bunch of vitamin A and protect you from getting measles. And please don't listen and read those people who are saying those things, because vitamin A toxicity is no joke. And you give vitamin A in the context of an acute measles infection to mitigate against complications. You don't give it prophylactically. It's a fat soluble vitamin. You can't see complications from vitamin A toxicity.
Okay, so we'll get to that in a minute because I wanna make sure that we are very intentional about explaining that it's a little bit complicated. And I don't know about your patient population, but I am seeing more vaccine hesitancy across the board. And I think some of it, this is just my biased opinion, was the way that Dr. Fauci handled the COVID vaccine boosters, not the vaccine itself, but the boosters. When he called for boosters every year for healthy people with very little risk, and the vaccine boosters from Pfizer never got FDA approval, and they were never asked to submit data to show benefit versus risk. And people were like, the kid got the vaccine, he got COVID, nothing happened to him. And now, can someone show me that this is safe and effective? And they're like, no, it is. You need a booster. And Pfizer needs its $110, this perpetual annuity for Pfizer and its executives. Do you think that hurt our ability to be credible with parents?
I think the credibility from authority figures and people with expertise is very much undermined nowadays. There is a desire to have so-called medical freedom and the Make America Healthy Again movement of the current political climate. That's what's happening nowadays, and that very much is something that is animating the politics of my state, particularly in rural parts of my state. I, I absolutely affirm that in the COVID pandemic, we were building the plane as we were trying to fly it, and mistakes are going to be made. Less than optimal advice is going to be given when you don't have all the information you need, but you're trying to save lives. But for people who enjoy leveraging these opportunities to enhance their own power and influence, that it's an opportunity for them to spread their own message. And that, unfortunately, is a much more popular message than the message that we've been trying to preach, which is to protect you. You're absolutely right, Herb. I think that in our zeal to try to protect people from infectious disease, sometimes there can be some braying and pixelating of the principles that we normally use to say, this is why we're doing this. Here's the risk. Here's the benefit. And it can undermine our credibility. Sure.
Yeah, I think that you underpromise and overdeliver. And as a physician, I think you have to be humble. And so I've been told to stop being a pediatrician because I say vaccines are not safe and effective, or all vaccines are safe and effective. Nothing's always all or none. Vaccines are a medication like any other medication. And what we look at is risk versus benefit. And the vaccines that are on the market, except the booster COVID shot, are they provide more benefit than they provide risk to your child. That does not mean that there's anything, and Dr. Offit says this, there is no risk free choice. The choice not to vaccinate is not without risk. You're just not putting that needle and paying for the vaccine at this moment, but you may pay with your child's life later on in life.
And the cognitive bias runs through all this. Okay. And one of the things that we encounter every day as pediatricians is omission bias. As parents, we feel more culpable and responsible for the decisions that we make to do something to our children. We feel less culpable and responsible for the decisions we decide that we make to not do something, but they're just as meaningful. And even more so when it comes to the vast majority of the infectious diseases that we have routine vaccines for. And we have to understand that. But at the same time, we'll be expanding more beyond your question, we have to meet people where they are. Our job is not to be right. Our job is to try to provide the best care we can for our patients. And you can't expect parents to understand the perspectives that we have because we've been doing this for so long. They just want to make the right choice for their kid. And that can sometimes get obfuscated by personal belief and culture and all those things that are completely beyond our experience.
Yes. But my point is, especially in this moment in our history, we have to be very careful with our language because it's easy to call me out on that flu vaccine is not a very effective vaccine. It's not. And if we were honest with ourselves, we would say we're not vaccinating low-risk kids with influenza anymore until you pharma come up with a vaccine that prevents 90% of the kids going into the hospital like Beyfortus does. Do a better job, pharma, because you're getting a ton of money for these vaccines. Do a better job. We need a better vaccine.
Entirely. It'll be wonderful when we finally get a vaccine, which is not going to be as susceptible to drift. But at the same time, almost always with every influenza season, even when the vaccine is not well matched, the purpose of vaccination, I tell my patients this, the purpose of vaccination for flu isn't strictly to keep you from getting the flu. It's to keep you from getting very sick with the flu. And when you look at the children who get hospitalized with influenza, the vast majority of those kids are unvaccinated. And so I think that there absolutely is a role and an important place for influenza vaccination for children because they have a higher risk of being very sick.
Yeah, I can attest that this past season was a pretty good, intense influenza season. Yeah. All the children that were really sick with high fevers, that their illness lasted 5-7 days, were always unvaccinated. Every now and again, you had a kid that received the vaccine, contracted the influenza virus. He got better in a couple of days, and his illness was far less severe.
And my experience this year with influenza was very similar, George. You get a sense when you're going through every winter, how does this winter feel, right? Okay.
Yep.
Does this feel like an easy winter or a hard winter? This was a hard winter for flu. And I recalled that it felt very similar to the swine flu outbreak of 2009, 2010. And I looked at the data, it's about where we were as far as the amount of cases. And I had so many more cases of influenza-associated pneumonia this year. It was so prevalent this year. And 100%, firstly, 100% of my patients who had a harder time, higher fevers, longer illness, complications, were unvaccinated kids.
Yeah. I don't know. To me, the H1N1 pandemic was much worse than this winter. I remember Sundays where we saw 80 kids just in one day in the urgent care. It was hellacious. This winter doesn't feel like that to me. It's very regional. Now, I want to ask you something. Does MMR cause autism?
No, the MMR vaccine does not cause autism. There is no single vaccine or combination of vaccines that causes autism or increases the risk for autism. It is, unfortunately, things on the internet never die, of course, but the allegation that the MMR vaccine or any vaccine is responsible for autism is completely been debunked. So many studies have been done looking at this, often as a result of trying to disprove a now discredited study from the 1990s. That is, I think, settled business. Despite that, because of the new Health and Human Services Secretary, will be dipping our toes into that question again, apparently, at the CDC.
So why is Andrew Wakefield and Jenny McCarthy, is their name, the blonde from California, not in jail?
What was that?
I think they took away his license. They took away
Well, they should be in jail. Why should they be in jail? Why are they not in jail?
Because we have principle of free speech in the United States. You're allowed to say what you want, larger degree in this country than in other countries.
But Wakefield went beyond that, right? He falsified data to get it published in the Lancet, and then he made money touring around the country telling parents that their children would develop autism if they got vaccinated with MMR, and he had a published paper in the Lancet, only to then be called out that he falsified the information. The article got retracted, and then he lost his license in England to practice medicine. And Jenny McCarthy's son or daughter, who quote unquote had um, autism, did not have autism. It turned out they had a different neurologic disorder, but she was walking around with a comedian doing rallies in DC, urging parents not to vaccinate their kids. And no one's really held those two. Carey, is it Carey?
Jim Carrey.
Jim Carrey, the guy from the Green Mask, right?
Yeah, Jim Carrey. Jim Carrey.
Yeah, that fool, that
Yeah.
idiot.
That guy.
No one's held them to account for the harm they did, not only to the children that did not get vaccinated, but the thousands of parents that heard that and got anxiety and suffered through the process of vaccinating their kid doing right. That's not free speech. That is lying to people, and that is criminal.
I agree.
Yeah. But it is ultimately done for the purpose of their own aggrandizement and
Or their money. I mean,
Any-
I'm not a fan of, and I don't mind saying the name because I've said it before on the podcast. I'm not a fan of any Kennedy, and I'm little less a fan of Bobby Kennedy. He is another trial lawyer, a liberal, a limousine liberal, and there are many of those amongst our ranks. And he's every other lawyer, and especially trial lawyers. They don't care about the truth. They represent their client to the best of their ability, and they get handsomely compensated for doing that. That's the world he lives in. I'm not saying he's an evil human being. His job is not to tell us the truth. His job is to represent you, whatever you are. If I'm in a divorce case and he's my divorce attorney to help me get custody of my kid, if I'm suing George over something just to get money out of George's practice for me, the truth doesn't matter to a lawyer. What matters is representing their client to their best of their ability and hopefully winning a payout so they can take 40% of it.
But the thing is, this is a symptom of where we are as a culture now. Okay. And if you look too far afield, for me, I'm speaking for myself. I'm well aware of what's going on beyond my fences, and I can involve myself in advocacy efforts along those lines. With my own emotional health, I choose to bring my fences in a little bit closer, just try to do my best where I am right now. And remember that my job is to be a pediatrician and to speak the truth, no matter what other authority figures that have now been appointed to high status offices may say. That there are other members of our society and other members of our profession who will take it a different choice. All we can do is be true to ourselves and true to the patients that we take care of.
Beautifully said. Beautifully said. We are only responsible. What is it that the psychologist tells you? You're only responsible of how you respond to something.
That's right.
You have control of how you respond. You don't have control over the world.
Herb, I'd like to tell you one quick little story because it's helped me. I have medical students and rest and sometimes rotate in my practice. And during COVID, I had a medical student from local medical school come through, and she was doing a 1-month rotation. And at one point, she asked me, "Dr. Terk, how do you remember all the different things you have to remember for all the age kids that you see for well checks?" And I said, "I've been doing this all the time." And then I said, "All you can really do is the best you can do." It was a throwaway line, right? And I forgot about it. At the very end of the rotation, she gave me a card, and she made a wooden craft painted on this piece of wood by quote, "All you can do is the best you can do, Dr. Terk." And it was a lovely gesture. And then about a year and a half ago, one of my patients who I'd taken care of since birth, regrettably, after he graduated from my practice, fell into a difficult time and he committed suicide. And it was devastating. And I sat there bereft, wondering, as we might all do, what could I have done differently to prevent such an awful outcome? And I happened to look over at my little shelf, and it said, all you can do is the best you can.
Yep.
Absolutely.
That's all we can do.
That's beautiful. Thank you for sharing that. That's very wise advice. Let's dig a little bit onto vitamin A because, the world around us, the TikTok world revolves about sound bites that are 10 seconds. So there is a use for vitamin A, right? In measles.
Yes.
And that use is in low to middle income countries where there's nutritional deficiencies. And in fact, it's part of the WHO recommendations on treatment of measles, which is to give too high dose vitamin A when a child's diagnosed with measles. And that does seem to decrease the rate of complications and death, correct?
That is my understanding. Yes.
However, taking turmeric, vitamin A, or extra vitamin C does not prevent getting measles.
That is correct.
And that is a big difference. So
Yes.
it is not a lie to say that vitamin A can be used when you have measles. It is a lie to say that if you take vitamin A, you prevent measles.
In an unvaccinated state, that's correct. Yes.
Yes. Okay. So that the audience can have a clear understanding of what we mean. And we're not telling people not to take vitamin A if they live in, I don't know, I'm going to say Colombia or Cambodia and their kid gets measles. But right now, if you're going to fly to Texas, you don't give your kids vitamin A, turmeric, or extra vitamin D or C because it doesn't.
It's certainly not going to keep you from getting measles.
Okay. All right. All right. And then I have run out of questions. What is there anything I haven't asked that you want to share with the audience that you think would be useful?
As the audience, I suspect, are mostly
Pediatricians.
much like us who are trying to do a good job. I guess what I would say is don't get discouraged. Remember why you're doing what you're doing. And there are so many factors that are beyond your control. Just do the best you can do. Impart the right information to the people that need to hear it. I make recommendations. They make decisions. And that's all we can do.
Yeah.
And
That's such a hard concept for the US based pediatrician. We are like lawyers. We give you counsel based on the law and the facts at this moment. But
we have to establish and reestablish and remind people of our common goals.
yes.
We both want your child to be healthy and safe and what possible. Okay. And remind them that's why you're there to see me or see George or to see you, Herb. And from there, we move forward. And hopefully, we're able to conduct care for the child that aligns with our shared values.
Yeah. But at the end of the day, the parent makes a decision and they own it.
That's right.
For better and for worse. Which is, like you said, you just got to let it go. And that's what the lawyers say. I counsel my client to the best of my ability. They don't want to take my advice. They need another lawyer and they own the outcome. I'm not the one going to jail.
And we walk away without some grief with situations that might have been prevented. But time, we're not responsible for the decisions that other people make.
No, but that's very hard when it's a child's life on the line. That's what's the moral burden of being a pediatrician. It's a wonderful career, but that's a real moral burden of a pediatrician. It's not the 40-year-old educated male deciding that they're not going to take care of their high blood pressure. It is a mother deciding that their kid's not going to do this or that, and that can lead to a bad outcome in a child. And that's hard. When do you think we'll see each other? I would love to see you in person.
Well, that's very nice, Herb. I spend a lot of time going to things in my state, do a lot of state level advocacy with the Texas Pediatric Society and the Texas Medical Association. I only rarely get to the aid because I blow my time away for education locally. But I do hope to run into you at some point and continue conversations and and fellowship.
Yes, thank you.
Great.
Thank you.
Let me ask you a little bit because I'm curious. So I'm a big fan of CME. So I will be at Nicholas Children's CME at the end of the month in Fort Lauderdale. But you didn't mention the American Academy chapter in Texas. You said the Texas Pediatric Medical Society.
Yeah.
What's the difference?
So I'm glad you asked this question, and I'm happy to inform both you, George, and Herb of the Texas Pediatric Society, which is the Texas chapter of the AAP. But we are the Texas Pediatric Society because we became an entity about 10 years before the AAP did. We've been around longer than AAP. And so we actually had a female president of the Texas Pediatric Society way before the AAP even became into existence. It's a little bit of a cognitive dissonance, but in some respects, we were more progressive in Texas than AAP.
And so are you on their board or are you on their advocacy side?
So I previously served as the president of Texas Pediatric Society, and I've served in a lot of different roles. I'm not currently on the executive board, but I am on a couple of their committees, and I'm a gray beard to call upon if they have questions.
And do they have councils like the other chapters do?
Yes. So the Texas Pediatric Society is the largest chapter of the AAP. We have about 3,500 members, and it is a robust chapter with lots of different committees. We have a strong medical student and resident section. We've positioned ourselves as an organization to be, as much as possible, the voice for children's health in Texas. And we are very active when the legislature is in session, which it is right now. We call it when the circus comes to town. We stand up a huge amount of effort in advocacy when it comes to legislative things when the session is going.
Oh, wow. Well, thank you
Thank
for
you.
sharing that. That's is we do have in Virginia pediatric medical societies that we get together and we have dinner once a quarter, but it's not related to the AAP. So this is the AAP chapter of Texas.
Correct.
Wonderful. I do hope to see you
Okay.
somewhere soon.
We'll see you.
George,
Thank you.
I'm
Thank
with
you.
much for inviting me. It's been a lot of fun.
It's a good idea. Thank you.
Thank you for sharing time on a Sunday with us. I know it's a sacrifice with your family time.
No worries.